Hi there. Welcome to this awesome collaboration between Anonymity 1D and Ginger Vieira. My name is Dave. I have been living with type 1 diabetes for many years. This is my daughter Brooke. Her best friend Mia has type 1 diabetes also.
My name is Susan. I am Mia's mother.
My name is Alex. My son Miguel was recently diagnosed with type 1.
Hi, my name is Ginger Vieira. I've lived with type 1 diabetes for 25 years. Living with T1D isn't easy, but the more we learn about the science of our body and insulin, the more we can do whatever we want to do in life, including exercise. In this video, we're going to talk all about the things you need to know to manage your blood sugar safely while exercising with T1D.
Please remember that this is for educational purposes only and is not meant to replace your doctor or care team. Thank you.
Thank you for the delicious lunch, Alex. You have a really cozy home here.
Ginger, the pleasure is ours. You have such a wealth of information and tips on how diabetes impacts exercise. Thank you for sharing all that with us.
My pleasure. I'm glad it was helpful.
You have now given me a framework on how to approach soccer with Miguel.
Oh, that is so good to hear. Let me share some lessons I've learned along the way about this process. First, research. Start taking notes when you exercise. What happens? What did you eat before that workout? What time did you eat and take insulin before working out? How much insulin? What was your blood sugar at the start of the workout? What type of exercise did you do? How long did you do it for? Next, notice obvious patterns. If you're going low every time you perform that workout, this tells you one very obvious thing. You've got too much insulin on board. That means you've got to make some changes. Next, consistency counts. Make up your mind on this because it makes a big difference. Are you going to exercise every day, every other day, once a week? If you're making this a real habit in your life, you'll benefit by making it a nearly daily habit because the impact on your blood sugar will be significantly more consistent too, which means you can kind of permanently change your insulin doses to match that daily new habit. And lastly, talk yourself through it. Remember, it is unlikely that you're going to see perfection every time you exercise. Just because yesterday's workout went perfectly doesn't mean today's will, but it's all part of the journey. Take it slowly. Take good notes. It takes time to learn the science of exercise versus insulin. And hey, remember to give yourself a pat on the back for trying. There are so many things you cannot control, and there are some things you can manage.
Ginger, those are all such valid points and good tips to remember as we are all figuring this out. What is a good way to approach any exercise?
The first thing to ask yourself with any type of new exercise program is this: what is your goal? If it's weight loss, then you should work more with insulin than with carbs. If it's for exercise performance, then you should make sure you are increasing your carb intake before and during exercise to maximize your athletic performance while managing your blood sugar levels so that you can minimize or avoid any interruptions.
My goal with CrossFit is to build muscle and stay fit.
I play soccer because I love it. Me too. I love volleyball.
Well, there you go. All our goals are different. So Dave, for you, that means you need to focus more on taking enough carbs and also protein and fat into your diet to build muscle, to perform in CrossFit. But for kids, that might mean really focusing more on preventing lows so you can enjoy your sport and have fun. Now, let's go over the main factors that affect blood sugar during exercise.
I know one factor, the type of exercise.
Another factor is carbs. The insulin on board also affects exercise.
And the other factor is timing. Timing of the exercise, timing of carbs, and timing of insulin.
Yes, that's perfect. Okay, let's go over them one by one. We'll start with exercise.
I remember this from when Dave taught us. Aerobic activity like soccer and volleyball can cause low sugars because the muscles eat up the sugar even without insulin.
Anaerobic exercise like CrossFit can cause high sugars during the activity and also immediately after because of the lactic acid buildup, which then gets converted to sugar. Mixed exercise, which is a combination of aerobic and anaerobic exercise, can cause both high blood sugars and low blood sugars.
I also remember that exercise less than 15 minutes may not affect sugars. So, when I am playing with my friends for a short while, Mom doesn't have to worry about lows.
Perfect. You guys totally got it. Also, soccer and volleyball practice might cause low blood sugars, but tournaments and competitions could cause high blood sugars because of all the excitement and the adrenaline. All right, next is insulin. What's the main thing to think about here?
Insulin on board. If there is a lot of insulin on board, it can cause blood sugars to drop. So, it's good to check that before exercise.
Yes. And what do you do if you have a lot of insulin on board before or during exercise?
I should eat some carbs to prevent my blood sugar from dropping.
Okay. And how can you make sure that you don't have too much insulin on board before exercise?
Fasted exercise would be ideal. If that is not possible, we should try to give a gap of at least 3 hours between an insulin bolus and exercise. Dosing less for the meal before the exercise is important, sometimes even by 75%. And for hybrid closed-loop pumps like Mia's, switching to exercise mode will help.
Exactly. And what do we know about insulin after exercise?
After exercise, especially exercise in the evening, can cause low blood sugars for up to 11 hours later. So, Mia may need less insulin for her meal after exercise, maybe 75% less. She is on a closed-loop pump, so the pump will cut back on her basal rate too if needed.
Miguel might need less nighttime insulin, but I will talk to his team to decide how much to cut back.
For anaerobic exercise like CrossFit, I may see a blood sugar spike after exercise as the lactic acid converts to glucose. So I may have to dose for that too.
You guys are total pros. All right, last one. What about carbohydrates?
Carbs are important for fuel. Protein and fat are just as important as it will sustain sugars. Having a gap of 1 to 1.5 hours between a meal and exercise will prevent huge spikes in sugars during exercise.
I should always have something ready to treat low blood sugars. Is that like the glucose tablets that you have with you? Brooke, that's right. Those are to treat my lows. But Dad, I see you use something else to treat your lows.
There are different options for low sugar treatments, depending on what kind of sugar they are made of. Some work faster than others, but they are all effective in raising blood sugars. And then, after exercise, even after anaerobic exercise like CrossFit, a carb and protein snack is needed, like granola bar and protein shake. This is important for muscle recovery. That snack may need insulin, but probably a lot less than the usual dose.
Dad said that I go low at night, so I need a similar snack at bedtime too, with a lot less insulin than usual.
And you can see how the timing is a big part of all that decision making. Here's one other really important thing to consider before you start any exercise. If you've experienced a severe low blood sugar recently, where you actually needed potentially glucagon or support from other people, talk to your healthcare team before you start exercising. If you have hypoglycemia unawareness, which means you don't feel the symptoms of low blood sugar, and you might have a lot of frequent lows, there's a big increased risk of you going low during exercise. So you need to talk to your healthcare team to figure out the safest way for you to take on a new exercise routine. And lastly, if your blood sugars are over 250, check for ketones first. If your ketones are above a certain level, exercising could actually make them worse. So you might want to take some correction insulin, drink some water, and let that take care of itself before you start exercising. For adults, another little thing to remember is that if you exercised in the afternoon or evening, and you're drinking a little bit of alcohol in the afternoon or evening, that alcohol can increase your risk for low blood sugars while you're sleeping, on top of the increased sensitivity to insulin you're going to experience because you just exercised. So definitely keep an eye out for lows and think closely about your insulin dosing before you go to bed.
Ginger, after we met last time, I was thinking about Mia's CGM. It tends to give me wrong readings when she is active.
Susan, I'm so glad you brought that up. Usually CGMs tend to lag behind the blood glucose meter readings. During exercise, that tends to lag even more, sometimes by 15 to 20 minutes. So if you're going to make a decision based on the CGM reading, it is recommended to actually check your blood sugar with a glucose meter before doing something like taking insulin.
What is a safe blood sugar range during exercise?
Some of the guidelines say it's safe to exercise with your blood sugar between 90 and 270. Personally, I don't want my body to be under the stress of exercising with a blood sugar that high. I might use a walk to help correct my blood sugar, but my real goal is to exercise with my blood sugar between 80 and 180, trying to stay in range safely and smoothly. If your blood sugar drops below 70, that's a sign that you might need to sit down, eat some carbs, and wait till you see it starting to rise before you continue exercising. Exercise with type 1 diabetes is definitely challenging, but it's not impossible. 3 things I want you to remember. First, stay motivated. The benefits of exercising with type 1 far outweigh the frustrations. You can figure this out, and you don't have to do it perfectly for it to be worth your time. Number 2, keep learning. I know I might sound like a broken record, but trial and error is what you need to do. It might feel like you are going nowhere at times, but I promise you, you'll start to see the repetitions and the patterns if you combine consistency with patience. Choose the same workout at the same time of day with the same food decisions and start to notice the patterns. Use the data to make adjustments and then try again the next day. You'll discover how your body reacts in different scenarios, and you'll be able to determine what keeps your blood sugar from dropping or spiking during different types of exercise. And the last thing I really want you to know is to remember that you are human. Even after you gather all that blood sugar data and you think you've got it all figured out, things can go wrong. Blood sugars can drop or spike, and that's okay. It's gonna happen. But how you approach it matters most. You can get frustrated, or you can look at the information, improvise, do your best to get your blood sugar back on track, and try again the next day.
Thank you so much for sharing all your valuable tips, Ginger. This has been a very special trip for me.
Yes, thank you, Ginger.
Thank you all, and thank you, Alex, for having me over. Have a great day.
We hope this video and all the others in this playlist gave you a better understanding of the complex relationship between exercise and type 1 diabetes. Please remember that this is for educational purposes only and is not meant to replace your doctor or care team.
Don't forget to like and subscribe to our channel and also check out Ginger's book about exercise. The link to that is in the notes.